everyone. My name is pharmacist Kuforiji Raheemah Opeyemi, an intern pharmacist of the pharmacy department, University of Ilorin Teaching Hospital. As today marks the World Hepatitis Day, awareness of global burden of viral hepatitis takes place every 28th of July. Hepatitis is a liver disease that is caused by hepatitis virus. It also means inflammation of the liver. Hepatitis virus has affinity for liver cells. It invades the liver cells and then multiplies them. The liver is a vital organ of the body. It helps to process nutrients. It helps in excretion of bilirubin. It helps to fight infection, and it helps in bile production. The infections form of this disease, such as hepatitis B and C, they are referred to as chronic form of hepatitis. They don't show symptoms in the beginning. They show the symptoms after the liver has been damaged. While the acute or short-term form of this hepatitis, such as hepatitis A and E, they show symptoms in the beginning. And the symptoms are fatigue, fever, dark stool, pale urine, abdominal pain, and yellow skin and eyes. There are 5 forms of viral infection that are classified as hepatitis. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Hepatitis A is an acute or short-term form of hepatitis. It is caused by hepatitis A virus. It can be contacted through ingestion or consumption of food or water that is contaminated with fecal matter of an infected person. Hepatitis B, it's a chronic or short-term form of hepatitis. It is caused by hepatitis B virus. It can be contacted through body fluids, such as blood, mother-to-child transmission during birth and delivery, and use of results of an infected person. And hepatitis C, it's a chronic or long-term form of infection too. It can also be contacted through body fluids, but this is typically sexual contact and injection drug use. Hepatitis D is a rare form of hepatitis. It occurs only in the presence of hepatitis B, meaning hepatitis D virus cannot multiply in the absence of hepatitis B virus. Hepatitis E is a waterborne disease. It occurs mostly in areas of poor sanitation. It can be contacted through ingestion of water that is contaminated with fecal matter of an infected person. Now to the treatment. Hepatitis A is an acute or short-term form of hepatitis. It does not require medications. The body fights off the virus itself. But in case there is discomfort, bed rest can be recommended to ease this discomfort. There is vaccination for hepatitis A. Hepatitis A vaccine can be given to prevent this form of hepatitis. Hepatitis B, it's usually a chronic form of hepatitis. But in case of the acute form of hepatitis B virus, there is no medication for it. It resolves on its own. As for a chronic form of hepatitis B, most people that are diagnosed with chronic hepatitis B infection, they get treatment throughout the rest of their life. The treatment helps to reduce the risk of liver disease and then to prevent transmission of this infection to other people. The treatments that can be given for hepatitis B infection are antiviral medications, interferon alpha injection, and then liver transplant in case of severely damaged liver. As for antiviral medication, such as tenofovir or etacavir or lamivudine can be given to fight against this virus and then to prevent further transmission. This treatment, it's expensive because It must be given for several years or months. As for interferon alpha injection, it is mostly given for young people that doesn't want to be on long-term treatment. It can be given to young women too, after completing a finite course of therapy that wants to get pregnant, because it must not be given to pregnant women. As for liver transplants can be recommended for severely damaged liver. Hepatitis B infection can be prevented through hepatitis B vaccination. Hepatitis C, it's a chronic form of hepatitis too. There is no vaccination for it. The acute and chronic form of hepatitis C infection can be treated with antiviral medications. So those people that are diagnosed with chronic hepatitis C infection, they will be treated with combination of antiviral medications. Hepatitis D, as I mentioned earlier, it doesn't occur except in the presence of hepatitis B. So vaccination for hepatitis B can also be used to prevent hepatitis D viral infection. Hepatitis E does not have vaccination. There's no medication for it. It resolves on its own. The body fights against this virus. But in case there's discomfort, bed rest, proper nutrition, plenty of fluids, and avoidance of alcohol can be recommended to ease this discomfort. The World Hepatitis Day takes place every 28th of July. In 2021, the theme is hepatitis can't wait. People living with hepatitis unaware, they can't wait to get tested. People living with hepatitis can't wait for life-saving treatments. Expectant mothers can't wait for screening and treatment. Newborn babies can't wait for giving birth, those vaccination. People that are affected with hepatitis, they can't wait to get rid of stigma and discrimination. Community organizations, they can't wait for greater investment. Decision makers, they can't wait, and they must act now to eliminate hepatitis through funding and political will. With every person dying every 30 seconds from hepatitis-related illness, even in this current COVID-19 crisis, we can't wait to act on viral hepatitis. Thank you.